Good morning, everyone. It's a pleasure to be here, and it's fantastic to be back on UK soil. It's been some time for us Kiwis to get back and visit the world, so I'm really happy to be here, and I look forward to engaging with you all across both today and tomorrow. So first of all, thank you for making the journey here to Bristol. It's great to see people from all parts of the UK and Ireland here, and a special welcome to the Malawi team who travelled here from Abu Dhabi and the Southern Cross team here from New Zealand. Before I start, I too wish to pay my respects to Her Majesty the Queen on behalf of Orion Health. As a New Zealand company, as a realm of the Commonwealth, Her Majesty has had a profound impact on all our lives in New Zealand, including the way healthcare is provided, with her continued support and dedication to what the NHS has done. We in New Zealand are currently going through healthcare reforms where we look to replicate an NHS-like model across healthcare delivery. I hope the work we all do together in healthcare, in a small part, will continue to contribute to the everlasting legacy she's left behind. So the foundations of healthcare delivery are all well laid out across all our countries today, but how do we make it better? We all know there are opportunities to improve access, be more efficient, and improve overall outcomes. Orion Health is a healthcare company 100% focused and dedicated on improving the well-being of the entire population. And we do that by providing technology solutions that support the delivery of population health management. So why are we all here today? Firstly, this is an opportunity to reconnect with you, our customers, even as an Orion Health One team. It's a good opportunity for you to talk to your peers and share the war stories of what has been a truly remarkable past 30 months. Our number one value at Orion Health is that we exist to delight our customers. This conference is an opportunity for us to listen and receive feedback from you. It's also where we can showcase the future of population health management from around the world and also the successes of many of you in this room today. Finally, COVID-19 has had a dramatic impact on the pace of digitalisation of healthcare, and it has shown us that the physical infrastructure cannot be scaled fast enough to deliver the outcomes healthcare systems need. It's going to require on digitalisation. So I thought I'd give you an update as where Orion Health is a company today. We have a stable leadership team. Gina, who's here today, James, Mark and Simon have all been with the company for several years, guiding it to revenue growth and profitability. After 30 years as our CEO, our founder, Ian McRae, retired in August, with myself stepping into the CEO role. I come from a healthcare background, having spent the last several years leading the global sales operations of New Zealand's largest healthcare company, Fisher & Paykel Healthcare, which provides respiratory equipment globally, including to all NHS hospitals and equipment around 130 countries around the world. We are supported by a strong founder-led board, Ian, Michael Falconer and Lucy Porter. We have a strong global presence, 600 employees located in 17 countries, and over 250 of them are focused on delivering technology solutions, and almost 200 involved in the delivery of our projects. We continue to be the world-leading population health management platform, with over 55 HIEs or IDCRs covering over 150 million patient records. The majority of these are very large in scale. Northern Ireland, as Gary mentioned, population of 2 million people, 150 system integrations with 50,000 end users. In Alberta, in Canada, our first HIE many years ago, population of 5 million, there are over 80,000 active end users. And in Saudi Arabia, one of our newest and largest HIEs will cover the population of 35 million. And connect over 5,000 government and private healthcare providers, to create a single, holistic view of every single person's medical information. As a business, we are privately held and profitable, and also proud to be celebrating our 30th year in business. All 30 of them with 100% focus on healthcare. So what's in the future for Orion Health? As already mentioned, the global digitalisation of healthcare is moving forward and moving forward fast. As a company, we are ensuring we are committing the resources to ensure project delivery, investing in our sales and marketing activities to ensure that customers are aware of the most innovative and world-leading solutions that have been delivered all around the world, including taking many of your successes out to other countries all around the world. And finally, we have a continued commitment and absolute dedication to innovation through R&D, specifically focusing on the future in data and analytical capabilities. Last year, we achieved over 150 million New Zealand dollars of revenue, and we see that upwards trend of revenue continuing. We clearly and simply believe that the future in population health management is required to improve the well-being of people, and we are leading the change with you as customers. Simply put, we are working towards, as a company, what we're working towards as a company, in collaboration with our customers, is improving the well-being of every person globally. And this will be achieved through the digitalisation of population health. And it's thriving. All around the world, regions are releasing digital transformation strategies. And all of the key themes that are coming out, there's a strong focus on data to engage with patients and ideally individuals before they interact with the healthcare system. There's the need to improve the care experience. There's a need to find a way to make healthcare more equitable and accessible to those who need it most. And there's definitely a need around backlog of patients and waiting lists around COVID. And finally, there's an absolute need for digital. Many of our population today, especially the Generation Y, who are just starting to have families themselves, have only ever grown up in the age of the smartphone. That's the way they've done everything, from learning to banking. And so why would healthcare be any different? The rise in population health management is because it has to be said that the global healthcare experience has been challenging, both for the carer and the patient. For patients, healthcare systems can be difficult to navigate with minimal information available. We've all turned to Dr. Google just because it's easy, not because it's necessarily the right way. And for carers, this results in sometimes ill-informed, frustrated patients, sometimes arriving into an institution that they don't need to be in, which ties up valuable resources and overall leads to diversion between what the carers really care about and the ability to care for patient outcomes. So with that in mind, we need a new way of thinking to support population health management. And wellness, in our view, and I think we've clearly seen in the NHS England definition, starts with empowering the individual, putting them and their families in the centre of their care. We know the legacy, institutional, clinician-centric approach that's worked so well for us in the past is not going to be fit for the future. What we all on the journey on to achieve is putting the patient at the centre of their healthcare journey, allowing them to engage with the healthcare system before they become patients. This doesn't have to be digital, pure digital, but it can also be telehealth services. And then we've got to empower the clinicians by firstly avoiding unnecessary interactions with the individuals who are not just patients yet, and secondly, ensuring they have access to the right information they need to be able to adequately streamline their care for patients. And finally, and so critical to the delivery of population health management, is capturing the data of the entire population and proactively delivering analytics, insights, and meaning from the data that predicts the care individuals need it before they know they need it. And as a company, we have a vision that is perfectly aligned to help deliver this new way of thinking. Our clear but necessary vision is for Orion Health to revolutionise global healthcare so that every person receives the perfect care for them. This means, quite simply, we target the right patient with the right care at the right place and when they need it at the right time. So the future we see is having the right data and individual engagement with the healthcare system that allows for a proactive, targeted, personalised intervention. The good news is that we were all here today well on the journey to achieving this together. We'll be hearing about some of these solutions today in much more detail, but I just wanted to give you a bit of a flavour of internationally what the Orion Health team has been working on. So firstly, the healthcare system, for healthcare systems to engage with individuals, we have just recently gone live with our first digital front door solution in Ontario. Ontario is the largest province in Canada, with a population of 15 million, and we have partnered with Orion Health to deliver on their vision for transformation and redesigning government services to improve the patient experience and navigating their way through the healthcare system, and ultimately reducing the burden on carers and clinicians in primary and secondary care. We will hear more about that later today. Also wanted to mention the Malafi HIE in the Middle East in Abu Dhabi. This was the first HIE in the Middle East with over 7 million unique patients. There are more than 47,000 users, 2,300 facilities connected, and 100% of hospitals in Abu Dhabi. I want to congratulate the Malafi team for achieving their 1 millionth unique clinical record just last week. As you can see from the statistics that I've just brought up, this is one well-connected healthcare system. The opportunities are endless. Well done. And finally, on the data and platform and analytics sides, we have Horizon, which is a large insurer in New Jersey and serves 3.6 million members. The data platform covers patient and claim data from strategic alliance partners, patient-centric medical homes, and accountable care organisations. And from this data platform, analytic-driven care plans have been able to be created, which has led to cost savings from patients receiving the right treatments the first time and avoiding duplications thereafter. So once the patient data from the different care providers are in one place, the opportunities are endless to enhance, to target, proactively intervene, and personalise the delivery of healthcare. So finally, I just wanted to finish on why people choose to partner with Orion Health to deliver technology solutions that help support population health management. It's quite simple. We are the world's #1 digital health platform. Our team has deep expertise. 30 years only in healthcare positions us with a deep healthcare-specific data and knowledge. And finally, we recognise that healthcare and digital solutions are moving forward at a fast pace, which sees us continue to invest in R&D to deliver the industry-leading technology solutions to you as customers. Thank you for your time, and I look forward to meeting and hearing from you about the population management health journey we're all on. Thank you.